Hi, I'm Tom Burke, the Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health, and welcome to Public Health on the Inside, your inside look into the world of public health. Today I want to introduce you to a close colleague, a friend, and the leader of our school, our Dean, Dr. Michael Klagg. Mike is a global expert on epidemiology and prevention of hypertension, cardiovascular and kidney disease, and he has served as the dean here at the school since 2005. He's a graduate of Juniata College, and he earned his medical degree from the University of Pennsylvania and his MPH from right here at the Johns Hopkins School of then Hygiene and Public Health. During his career, Mike has won numerous awards and accolades and was recently named the 2013 recipient of the James D. Bruce Memorial Award by the American College of Physicians. He's also the immediate past chair of the Association of Schools of Public Health, which has given him a broad influence on public health education and an interesting lens to take a look at where we're going. So, Mike, congratulations on your award, and welcome to Public Health on the Inside.
Thanks, Tom. It's great to be here. I've been looking forward to this.
First, I want to ask you about the journey. You hear about Juniata College, University of Pennsylvania, a clinical career, research career, and dean of a school of public health. Tell us how you've been inspired to move forward, and tell us a little bit about your own personal interests and trajectory.
Well, it's interesting. I never thought when I was growing up I'd be a physician. And I went to college and was a biology major. And I had read a book by a guy named Tom Dooley that young people today probably don't remember who Tom Dooley was, but he was an American physician who created an NGO to serve people in what was then called French Indochina. And he wrote several books about that. And that really inspired me, I think, to go into medicine. And then I went to University of Pennsylvania, which was a research-oriented school. I had done a fair amount of basic science research up to that time and really decided that I really enjoyed interacting with people and wanted to be a clinician and really tried not to do research. As I became a clinician and became interested in teaching, I realized I didn't really know how to weigh the medical literature and that I needed to get the tools to understand clinical research and clinical trials. And that led me to epidemiology. And I was shocked when I came to Hopkins in '84 that, one, Hopkins was such a warm collegial place, and two, I found I really loved research. So I stayed and did that. And always was active here in the school, but more from the side of clinical epidemiology. And being dean has been just a great job. It's so much fun. We have, as you know, great students who make you feel good about the future of the human race. We have faculty who work around the world, do a lot here in Baltimore and Maryland, but work in 120 countries. It's an incredibly stimulating, uplifting job.
You've never been afraid to pivot and try new things in your career either. And you've worn a lot of hats, but I have to ask you about, you have a unique perspective on where the field is going. I'd like to get your thoughts on that.
It was an honor and a privilege to serve as chair of the Association of Schools of Public Health. And in that role, we always interact with other deans, but I did so much more and had a lot of in-depth discussions about the future of public health and learned a lot, but saw about the broad range of activities in public health. And one of the challenges of being dean, for everybody who's in public health, of course, is explaining to people outside the field what public health is and what we do. And we have tremendous heterogeneity in our school. There's tremendous heterogeneity across schools as well. And so I think schools have different kinds of focus and, they attract students for different kinds of careers, different faculty. But I think everybody would agree, if we could fit all the deans of the 50 schools in this room, they would agree that now is a good time to stop and think about the future of public health education. We're about to celebrate the 100th anniversary of the Welch-Rose Report. ASPH has commissioned a task force on framing the future, and there's been great discussion about what should public health education be going forward. One change that's been remarkable has been the growth of undergraduate public health education. As you know, the Welch-Rose Report stipulated a graduate school model. I think for 20 years or more, we've had an undergraduate major here. It's now the most popular major in our School of Arts and Sciences. We've seen an explosion of interest in undergraduate public health. And so the big question there is, how does that differ from what we teach at the graduate school level, at the master's level? How do you articulate what's being taught and the competencies of somebody with an undergraduate degree versus a graduate degree? I think we were the first. We used to call it a certificate in public health, and then in the 30s came up with the name Master of Public Health. That's been the bedrock of our graduate school education, and I think it should continue to be, but not everybody does. And so that's another interesting discussion that's going on.
That's a huge change. Another huge change is that, well, let's face it, you and I are doing a podcast right now.
Mm-hmm.
We wouldn't have thought we were going to do these things 20 years ago. We're reaching an audience that perhaps we wouldn't have reached before. Mm-hmm. And we've been pioneers in distance education. Give me your views on that.
I was always a PhD advisor in the school, and when I first came on the faculty back in '87 in the School of Medicine, I had very close ties here. But gradually, as my administrative responsibilities in medicine grew, that was less so. So I was really surprised when I became dean in 2007 with the magnitude of our online education program. We started in 1997, so we've been in it for 15 years. We have an online MPH program since shortly after that period. And now we have almost twice as many online students as full-time. We have about 240 full-time students and about 400 students online. And we haven't never branded it as online. We've always called it part-time MPH, but it's essentially 80% of the credits are given online. I was a skeptic because all of us who have been students know the impact the personal interaction with a inspirational teacher can have. And I was worried that the students who were online students would not understand the ethos of our school, the culture, what makes it so special. And I just couldn't have been more wrong. Perhaps it's because they do 16 credits here, but those students, they're older, they're more mature, they're in the workplace, and so they're much more targeted at what they want to get out of the degree. They've gone on to do great things, and they really become part of our school community and in ways I just would not have anticipated. So it's been a wonderful experience for us to have this online program.
Mike, there's a huge change happening in graduate education now, and that is open courseware.
Yes.
And the school has probably been the pioneer in public health in that area. Tell us about that.
Well, yeah, since 2005, we've been a participant in the Open Courseware Initiative and the Public Health Representative, and we have the curriculum of over 100 courses on the web for free, and they're used all over the world. Anybody can use them. They can modify them as long as they don't make money from it. So we've had a commitment to that. But most recently, we've been involved with the MOOCs, the Massive Online Open Courseware, and we've partnered with a Coursera, a company that grew out of Stanford. And that's just been an unbelievable experience. In June, we announced we would do 8 courses, and I think we have completed 2 courses on the web, and the rest are either in progress or will be done. And so far, 180,000 people have registered for those courses. Our faculty have really enjoyed it. We have students from all over the world. They form study groups, and it's a way to bring the power of public health. We all believe public health is important, and that the more people who understand the principles of public health, the more informed decisions that we'll have. So that's been a wonderful experience for us. We're not sure. Nobody's sure what the future of these MOOCs are, but it's been just a really gratifying experience for us to be involved.
What a tremendous resource for practitioners all around the world who wouldn't normally have access. And I know our faculty involved in it absolutely love it.
It is a great resource, and I think that especially for those people who know nothing about public health, it's an opportunity for them to take a sampler, a small biopsy, and be exposed to what we believe are really important concepts.
Mike, I always enjoy speaking to you because your clinical nature slips back in and a sample becomes a biopsy.
It's a small piece. It's just a small piece.
Absolutely. And you've also pushed the school in a new direction in practice. Now, we have very strong historical roots in research and practice, but you're kind of pushing the envelope in getting us out there into the practice community, changing incentives, and changing the educational structure.
Well, you know, and I know our school used to be called the School of Hygiene and Public Health, and that reflected a debate that occurred when the school was founded. Would it be a research institute, hygiene from the German model, or would it be public health practice? And it couldn't be solved. So they put both. We had a very long name, and they put both names in the title of our school. So it's always been there. I think, perhaps because as a physician who practiced, I saw the importance of having both activities within a school. And I think all of our previous deans have felt the same. For us, we've been able to stand on the shoulders of others. I think the Carnegie Foundation and others, and your leadership and the leadership of our A&P committee, to say what does practice mean in the setting of an academic institution like ours? And as you know, anything we do in whether it's practice or whether it's research, unless you tell people about it, unless you publish it or use electronic media, it doesn't make an impact other than the small number of people. So that's what we've learned, I think, is that we've learned how to recognize the practice contributions of our faculty. And I believe that advocacy and practice is a part of everybody's career, and some will do more than others, but it's something that we should recognize in every faculty member and have expectations.
I think that's perhaps the greatest thing about the culture here. It is about research, but it's also about that continuum to practice and change in community health, the millions at a time thing. Mike, in closing, lots of our students have dreams of leadership in public health, and I wanted to ask you, what advice do you have for them for the future as they face the challenges ahead?
Well, I think we could spend all day talking about leadership, but I think that clearly integrity, building trust, being able to communicate, and being able to step back from the daily fray of the thousands of emails or the pressures that you have and take the long view and always keep in mind that you have to think both strategically and tactically. That's what I think is a big challenge for everybody who's a leader, is that, especially when there's a resource-poor environment, how do you step back and remember that the objective is to drain the swamp when you're surrounded by alligators.
Mike, it was a pleasure speaking with you today. Thanks for sharing your knowledge, expertise, and experience with us. Thanks for all the things that you do for the school. And a special thanks to our listeners. Until next time, this is Public Health on the Inside.